So, what are the tools we can use to manage menopausal symptoms? A holistic approach addressing physical, psychological, and social aspects is essential. First, take good care of yourself. This is the usual information. You've heard it all before. Reduce your alcohol intake, stop smoking, exercise more, prioritize rest and sleep. But researchers have identified that the vasomotor symptoms of menopause are made worse by alcohol, excess weight, and smoking. Physically active women report less nervousness, fewer symptoms, and have a happier outlook. It is so worth the investment in yourself, and it may remove the need for medicalized treatment. After nearly 50 years as a pretty sedentary person, I started exercising daily and even running, and it was a game changer for me both mentally and physically. I encourage you to do one small thing to get started. A 5-minute walk today is 5 minutes more than you did yesterday. Second, pay attention to your diet. Oh my, this is a hard one for me. Researchers noted that refined and sweetened foods are associated with depression, while eating fruits and vegetables and other high fiber foods are protective against it. With that said, it's about moderation, not deprivation. It's okay to have a little treat from Rio Thompson once in a while. Third, find your flock. Social support, belonging to a community, reduces isolation, increases our understanding of menopause, and increases our ability to cope. Sometimes women tend to withdraw during the menopausal transition as they struggle with vasomotor and physical symptoms such as excessive bleeding, or they feel too crabby to socialize after a sleep-deprived night. I urge you not to do this. Your mental health, your coping skills, and your feelings of belonging will all improve when you find your flock. Fourth, try a little therapy. Psychotherapy can help you sort out your feelings about the things that stress you out. Maybe you have lots on your plate with caregiving for others. Maybe you're lonely. Maybe you don't know who you are anymore. Maybe your boss just doesn't get menopause. A good therapist can work with you to discover strategies for thriving. Cognitive behavior therapy, CBT, is shown in the research to be effective for depression, anxiety, sleep disturbance, and vasomotor symptoms, and it can significantly improve our well-being. Fifth, you can talk with your doctor about antidepressants. Some of these medications will treat both depressive symptoms and vasomotor symptoms. Many of the journal articles I read suggested that after implementing lifestyle changes and therapy, antidepressants should be the next intervention before MHT is offered. Sixth, if you have vasomotor symptoms, those hot flashes and night sweats, you might consult with your doctor about menopausal hormone therapy, or MHT. It's important to consider first that hot flashes are part of the menopausal transition, and most women don't necessarily want or need medical treatment of this symptom. However, if vasomotor symptoms are severe or debilitating, MHT can be effective for those, but interestingly not effective for other menopausal symptoms. Researcher Dr. Martha Hickey notes that there's need for greater transparency around how these products are marketed, such as the widespread use of terms such as bioidentical, which imply that MHT is completely natural and safe. However, we know that MHT is not without risks. Please talk to your doctor about your specific situation. Seventh, consider alternative therapies. While the research is not as robust when it comes to things like hypnosis, yoga, craniofacial massage, and foot reflexology, many researchers have found in small-scale studies that these methods can be helpful. Another technique, mindfulness-based stress reduction, or MBSR, promotes resilience and decreased anxiety and lowered depression. Be very cautious around herbal preparations. While some studies show some of these to be useful, toxicity and side effects can be significant.